Hey everyone. Today we're talking about something that affects 1 in 10 women worldwide, Polycystic Ovary Syndrome, or PCOS. If you're dealing with irregular periods, stubborn weight gain, acne that won't quit, or trouble conceiving, this video is for you. PCOS isn't just about cysts, it's a complex hormonal condition affecting your metabolism, skin, hair, mental health, and long-term disease risk. In the next 12 minutes, I'm breaking down the key symptoms you should never ignore and why early detection can change everything. Let's dive in. Irregular periods. Symptom number 1. Irregular menstrual cycles, often the first red flag. If your periods are consistently longer than 35 days apart, or you only get 4 to 6 cycles yearly, that's oligomenorrhea or amenorrhea. In PCOS, hormonal communication breaks down. Too much LH, not enough FSH, excess androgens, your eggs never mature and you don't ovulate. Without regular ovulation, your uterine lining builds up under unopposed estrogen. When it finally sheds, it's heavy, painful, and unpredictable. Here's why it matters. Chronic anovulation increases your risk of endometrial hyperplasia and cancer. If cycles stay irregular beyond 2 years after your first period, get evaluated. Hirsutism symptom 2. Excessive hair growth or hirsutism. Thick, dark, coarse hair on your upper lip, chin, chest, lower abdomen, back, and inner thighs. Places women typically don't have much hair. Elevated androgens transform hair follicles from producing fine hair to thick pigmented terminal. Insulin resistance makes it worse by lowering SHBG, which normally binds testosterone, meaning more free testosterone, more hair. This isn't just cosmetic. For many women, hirsutism devastates self-esteem and affects relationships. Women spend hours weekly and thousands annually on removal. The good news? Medications like spironolactone, birth control, and laser therapy work, but you need a diagnosis first. Acne and oily skin symptom. Persistent acne and oily skin into your 20s and 30s. Watch for this pattern: acne along your jawline, chin, chest, and upper back, androgen-sensitive areas. Excess hormones ramp up oil production, clog pores, and create the perfect environment for acne bacteria. The frustrating part? Conventional treatments often fail because you're treating the symptom, not the hormonal root cause. When adult acne combines with irregular periods or excessive hair, that's your body signaling a hormonal issue. Don't let anyone dismiss it as just acne. Weight and insulin resistance symptoms, 4 and 5 go together. Unexplained weight gain and insulin resistance. Many women with PCOS struggle with weight, especially around the abdomen. You might eat right, exercise regularly, and still the scale won't budge. Here's why. Insulin resistance. Your cells stop responding to insulin, so your pancreas produces more. Insulin is a storage hormone. It promotes fat storage, especially abdominally, and increases androgen production. It's a vicious cycle. Signs of insulin resistance include extreme fatigue after meals, intense carb cravings, brain fog, constant hunger, dark, velvety skin patches, acanthosis nigricans, on your neck, armpits, or groin. Up to 70% of women with PCOS have insulin resistance. It increases your risk of type 2 diabetes by 4 to 7 times. Testing fasting glucose, insulin, and HbA1c is crucial. But here's hope. Addressing insulin resistance through diet, exercise, and sometimes metformin makes weight loss achievable and improves all PCOS symptoms. Even 5 to 10% weight loss makes a huge difference. Infertility and hair loss symptom. 6. Difficulty conceiving. PCOS is a leading cause of infertility due to chronic anovulation. No ovulation, no egg. Even when ovulation occurs occasionally, egg quality and endometrial receptivity may be compromised. If this is you, I'm sorry. Infertility is heartbreaking. But there's hope. Lifestyle changes, ovulation-inducing medications like Clomid, and IVF have helped countless women with PCOS become mothers. Symptom 7. Scalp hair thinning. While growing unwanted hair elsewhere, many women lose scalp hair, androgenic alopecia. Androgens shrink scalp follicles, causing thinning at the crown and widening part lines. Hair loss is deeply tied to identity. Treatments like minoxidil and anti-androgens help, but starting early is key before follicles are permanently damaged. Mood and sleep disorders. Symptom 8. Mood disorders. Women with PCOS have 3 times higher depression rates and 5 times higher anxiety rates. This isn't just about dealing with symptoms. Hormonal fluctuations affect neurotransmitters like serotonin and dopamine. You might experience anxiety, depression, mood swings, irritability, or eating disorders. Sleep disturbances and body image struggles compound this. Mental health symptoms are real and valid. They need treatment just as seriously as physical symptoms. Therapy, support groups, sometimes medication, and treating underlying PCOS all help. Symptom 9. Sleep disorders, especially sleep apnea. Women with PCOS are at higher risk for obstructive sleep apnea, loud snoring, breathing pauses, gasping, morning headaches, and daytime exhaustion. Sleep apnea worsens insulin resistance, which worsens PCOS, which worsens weight gain. If you suspect this, get a sleep study. Treatment can be life-changing. Pelvic pain and long-term risks. Symptom 10. Pelvic pain and ovarian cysts. PCOS ovaries develop multiple small follicles that fail to mature, the string of pearls on ultrasound. Most don't cause pain, but some women experience dull aching, bloating, or discomfort during sex. Critical warning: sudden severe pelvic pain with nausea could be ovarian torsion, a medical emergency. Go to the emergency room immediately. Now, the long-term risks, why early diagnosis is crucial. Type 2. Diabetes. Women with PCOS have up to 7 times higher risk. Cardiovascular disease. PCOS increases risk of high blood pressure, high cholesterol, inflammation, all major heart attack and stroke risk factors. Endometrial cancer. Without regular ovulation, the uterine lining builds up without progesterone protection, increasing hyperplasia and cancer risk. Any abnormal bleeding needs immediate evaluation. Other risks include fatty liver disease, gallbladder disease, and thyroid dysfunction. These risks sound scary, but they're significantly reduced with early diagnosis and management. That's why recognizing symptoms early is powerful. All right, let's recap. If you're experiencing any of these symptoms, especially in combination, talk to your doctor about PCOS, irregular periods, excessive hair growth, persistent acne, difficulty conceiving, unexplained weight gain, fatigue and carb cravings, scalp hair thinning, dark skin patches, mood changes, sleep problems, pelvic pain. The good news? PCOS is manageable. With the right combination of lifestyle changes, medical treatment, and psychological support, you can feel so much better and protect your future health. If you found this helpful, please give it a thumbs up and subscribe for more health content. Drop a comment if you have PCOS. What symptoms do you experience? Let's support each other in the comments. And remember, having PCOS doesn't define you. With the right care and self-compassion, you can absolutely thrive. I'll see you in the next video. Take care of yourself. Next up, Polycystic Ovary Syndrome, PCOS. Diagnosis: how doctors identify PCOS, what tests are done, and what your results really mean. Don't miss it.